The sun was already setting on the traditional in-office business world, but this past year drastically upended that conventional style. Established ways such as having a workforce in one location and one-size-fits-all benefit plans quickly fell out of favor as 2020 became an accelerant that forced a reckoning on all fronts. From business practice to healthcare packages, companies on the cutting edge of technology and innovation fared far better than those who were slower to adopt new methodologies. In short, outdated traditions are being replaced by various healthcare solutions. So let's quickly focus on one solution that transcends socioeconomic and geographic barriers for employers of every size. The Direct Primary Care Model, or DPC for short, is a healthcare payment model where patients or consumers pay for their membership directly in the form of periodic payments for a defined set of primary care services. DPC emphasizes the relationship between a patient and his or her family physician in order to improve health outcomes and lower their overall healthcare costs. This model has evolved to be a cost-effective solution that makes healthcare more accessible to everyone, often via a multi-platform delivery of care through virtual or in-person visits. Now, the pandemic taught businesses to lean into flexibility. A recent survey actually found that 74% of CFOs plan to keep their workers remote after the pandemic. From a financial standpoint, having a remote workforce simply makes sense. The cost savings have allowed many companies to avoid further severe cuts and downsizing. Situations like these will raise new healthcare issues for their teams who are working from a variety of locations. And for those employers who are forced to lay off workers, shrinking headcounts could also have an unforeseen impact on their insurance premiums. What that means for employers is that the traditional options for health plans are simply incongruent with how employees live today. To meet this demand, traditional direct primary care has adapted to a hybrid approach that fills this ever-widening void for employers who have remote employees in various states and mobile workers who live on the go. A hybrid direct primary care model is especially beneficial when it's a nationwide network of physicians accessible in any state. This approach has been a game changer for companies who are expanding their remote workforce across state lines. It's also extremely beneficial for restaurants, hotels, and other hospitality industry businesses with locations in multiple states. Each provider has its list of particular services, but some DPC membership benefits may include the following: patient advocates to support members in navigating their healthcare options, 24/7, 365 access to their primary care provider via telehealth, unlimited in-office visits for a minimal to no fee, annual physicals provided to establish a baseline for a member's health, and finally, early-stage chronic disease management. It's helpful to have health insurance for catastrophic life events, but being able to see the doctor when you're ill without paying expensive deductibles or copays is a reason people love direct primary care. DPC also pairs well with minimum essential coverage, high deductible health plans, medical cost sharing memberships, and many other healthcare services. In conclusion, traditional direct primary care practices and hybrid DPC organizations are working together to ensure people of all socioeconomic backgrounds can get the healthcare they need to live happier and healthier lifestyles. If you'd like more information about access to affordable and convenient healthcare, let us know. As the nation's fastest growing hybrid DPC provider, Healthcare2You partners with organizations nationwide to provide affordable and convenient access to our unlimited primary medical care.